Hey guys, Dr. Stan here. So I was having a conversation today about x-rays. And x-rays kind of have a negative connotation to them. And I get it. I understand why. We hear about radiation and cancer and all this other stuff. And yeah, we don't want to be exposed to more x-rays than we need to. It's but we'll have oftentimes people come in and say, well, I've had x-rays before. I had x-rays at the hospital. I've had an MRI report. I had a CAT scan. Will that work for what we do? And unfortunately, no, it won't. The x-rays that we do are very specific to what we do. So we take 3 very specific x-rays of the head and neck, one from the side, one from the top down, one from the front. That gives us a 3-dimensional picture of what this is doing. And if we're not intentional about our x-ray setup and making sure that everything is even and aligned, and for example, the x-ray we do from the front, we can't have more than 2 millimeters of rotation and still consider it an accurate film. And the reason that is we can take an x-ray and look and see if there's anything bad on it. But when it comes to correcting the upper cervical subluxation, there's about 1,200 ways this can misalign up there. And when we're working this close to your brainstem, you want us to be pretty accurate. And so to be able to measure pre-x-ray and post-x-ray to see if we get a full correction, taking the pressure off the upper cervical spine here, we have to be very accurate and very diligent in our x-ray taking to make sure we don't have more than 2 millimeters of rotation, to make sure that on the x-ray where your chin is in the cup, that our nose and our C2 and our neck are all right on center so we can see what the rotation is doing in the atlas. And it's that attention to detail, that meticulous nature of paying attention to detail and making sure we're doing it right. And if we don't do it right, doing it over again. That's what gives us the ability. What gives us the most accurate roadmap possible to correct this pressure, to take the pressure off of the nervous system, to allow the body to start to function properly, to allow the brain to control everything that's happened down in the body. And we can't do that without proper x-rays. And so when the hospital does the x-ray and they say, okay, everything's good, it's not broken, you've got some arthritis. Well, I talked about that in another video. It kind of drives me nuts because they never tell you why it's there. But that's what they're looking for. They're not looking for alignment. They're not looking to accurately and precisely correct this vital part of our body right here. And so that's why we do x-rays. When someone says, do we have to do the x-rays? Yeah, we do. Another reason we do x-rays, I almost forgot to say this, and have a patient a long time ago. Her mom and dad were patients, and their daughter was in college and nursing school at the time, and they said, hey, can we get our daughter in? Her neck's been giving her problems and we'd like to get her checked. Yeah, no problem. So we do the x-rays, and the very first one from the side that we see, so we have C2, the second cervical vertebrae that kind of looks like a thumbs up in a way. We got this odontoid process sitting right here on top of it. And then like a ring, the atlas sits right on top of that odontoid process. So it kind of goes like that. So when that happens, it keeps everything in alignment. The atlas pivots around. Well, she didn't have this part. So she didn't have this odontoid, and her atlas was sitting back here like that. So basically her upper neck spinal cord was going, putting a lot of pressure, and she was born that way. And she probably could have lived a normal life like that. But if she would have been in a car accident, maybe someone would have gotten a little neck stiffness out of it. That could have severed things. That could have killed her right there. Her neurosurgeon, when she went and had a consult with them, because we told him, look, you need to get this taken care of right now. He said, look, we don't have to do it right now, but you need to do it soon, because you could tip a beer back too fast and that could be it for you. And so ever since then, when someone asks, do we have to do x-rays? Yes, because we don't know what's going on in there. And this part of the body is way too important to guess with. And so we're not going to guess with your spine. I hope you guys have a good night. We'll talk to you later. Bye-bye.